Hello, everyone. We are Group 2, and we are here to present you our mental health presentation in our Community and Mental Health Nursing course. My name is Jan Edward Panganiban. Together with me are Baljit Dilan, Gagandeep Hayer, Babneet Kaur, Simranjit Kaur, Paul Joseph Limson, and Aurora Christensen Joanne Miranda. So we are here to present a community called Thistletown Beaumont Community. We're here to present a case study, nurse-patient interaction, plan of care, community resources, nursing consideration, and assessment tool, and lastly, our references. So for our case study,
Everyone, my name is Joanne, and our case study is our client's name is Abasame Bar. She is a 31-year-old Afghan refugee and currently lives with her two daughters. She has been suffering from post-traumatic stress disorder. She has no permanent job and can hardly speak English. She has lack of knowledge on healthcare services in the community, lack of social interaction, and recently diagnosed with HIV, had verbal and physical abuse from partner, and has a fear of transmitting HIV to her daughters.
for the nurse-patient interaction, hi, good morning. I'm Jan. I'll be your nurse today. I'll be happy to assist you. How would you like to be addressed?
Hi, Nurse John. You can call me Abasame.
How are you, Abasami?
I am okay. I think I need help with something.
How can I help you today?
I am here because I am seeking some professional help with what I am going through right now and what I have been recently diagnosed with.
Let me accommodate you to the room inside to give you some privacy, and we can discuss your problem there. Is that okay?
Yes, please. I appreciate it.
Okay, I'm more than happy to help. Are you comfortable now? Tell me how can I help you? All the information that you will be shared will be kept confidential within the healthcare team.
Yes, I am more comfortable here. Thank you. I am a refugee here in Canada and currently living with my two daughters in an apartment in Thistletown. We moved here because I saw how my husband was killed in a bombing in my home country and I was so traumatized when that happened. I think I have PTSD. I did not know what to do and I am still suffering from losing my husband. It's very hard to raise our children who are now in grade 3 and grade 2. We were moved between hotels multiple times when we first arrived in this country.
It must be very hard and stressful. It's good that you came by to our clinic to seek professional help.
That is true. I have no familiarity with the health services available in this community, and I am afraid to go to clinics because I hardly speak English. When I have no work, I just stay in my apartment and only leave when picking up my children from school.
I can only imagine. But don't worry, we're here to help you.
Thank you, Nurse John.
You mentioned something about your recent diagnosis. Would you like to tell more about it?
Yes, I had a relationship with a guy I met from my work, the butcher shop, but it did not end well as he was abusing me verbally and physically. And now, unfortunately, I was recently diagnosed with HIV, and I'm afraid I have transmitted the virus to my daughters. I don't know what to do because I do not know anything about this infection.
Abasami, I appreciate you for sharing this with me. I understand it's very tough, but here's what we will do. After listening to your situation, I'll build a plan of care for you to link you to the services in our community, okay? Hopefully, this will help you with what you're going through right now. If you have any questions, you can always come back here and you can ask me.
Sure, I really appreciate your help, Nurse John.
Okay, for now, here are some pamphlets you can read for more information about HIV and PTSD.
Okay, thank you so much, Nurse John.
Now for the plan of care.
Hi, my name is Pamneet. The strategies for Abysame would be the counseling. In the absence of a viable vaccine or curative therapy, HIV counseling is a critical modality of behavioral intervention. It entails dealing with the various difficulties, including medical, psychological, and social concern. Reduction counseling, pre-test counseling, and post-test counseling are the three main types of prevention counseling. Then the reduce the risk of transmission. Using HIV medication, HIV prevention medication, condoms, having only low risk sex, having partner with the same HIV status, and avoiding having sex can all this successfully lower a risk. So, assist the patient to find HIV medical treatment, housing help, and drug addiction and mental health programs in the community that will help the patient. Provide guidance to make contact with organizations that can assist her in the determining what assistance you are entitled to and obtaining them. Educate her that she may be eligible for medical care and other vital support services if she does not have health insurance or the financial means to pay for them. Tell her if she has HIV and is unable to work, she may be eligible for Social Security payment. HOPWA is the only federal program dedicated to helping HIV positive persons find homes that will also help the patient. The CDC's Business Response to AIDS initiative can provide the patient customized material and tools.
Hi, I am Gagandeep here. So here I will discuss the building trusting relationship part. This the nurse has to maintain therapeutic relationship with AVSM. In this, the nurse will introduce herself first and call the patient by her name. She will actively listen to the patient and respect her feelings and reactions. Make eye contact with the patient and keep smiling and nod her head during conversation. Do not interrupt the patient while speaking. Always speak softly and slowly to feel comfortable. Keep in mind to maintain professional boundaries also. Second one, use therapeutic communication skills. In this, make eye contact with the patient and keep smiling and nod her head during conversation. This will make the patient feel you are interested in listening to her. Do not interrupt the patient while speaking. Next, nurse will provide her personal support worker services. In these consistent schedules at her home can help her to regain a sense of stability and security. Creating routines could include things like encouraging her to help with groceries or housekeeping, keeping regular meal times. We can also refer her to some community places. In this, help her to visit some recreation parks with facilities in this community so that she can feel happy and relaxed. Indulge her to do some exercise activities like running, walking, dancing, etc. Next are the statistics. According to Schlacombe 2021, HIV is a virus that can cause the immune system, the body's natural defense against sickness and illness, to become weakened. According to national HIV figures, there were 62,050 HIV positive Canadians at the end of 2018. This indicates that out of every 1 lakh Canadians, only 167 had HIV. That is the prevalence rate. In comparison to 2016, when there were an estimated 1,960 new HIV infections, the number of new HIV infections increased slightly in 2018. The United Nations Programme on HIV/AIDS and the World Health Organization have devised a worldwide health sector plan on HIV to help eliminate AIDS as a public health issue by 2030. Canada is reaching the 90% goal for HIV awareness and treatment and has already reached the 90% goal for viral suppression. In 2018, an estimated 62,050 persons in Canada were living with HIV.
Hi, my name is Baljit Khartilo. Today I am discussing about legislation about HIV. In 2012, the Supreme Court of Canada held that the criminal law imposes a duty on a person to disclose HIV positive status before sexual activity that poses a realistic possibility of transmission, so that HIV negative sexual partner has the opportunity to choose whether to assume the risk of being infected with HIV. Subsidies. Refugees are people who have been forced to leave their country in order to escape war in precaution. For reasons such as these, they are not able to return home. A refugee is different from an immigrant. An immigrant is a person who chooses to settle permanently in another country where refugees are forced to flee. The Canadian refugee system has two main parts: the Refugees and Humanitarian Resettlement Program for the people who need protection from outside Canada. The in Canada Asylum Program for people making refugee protection claim for within Canada. Resettlement Program government assistant refugees are usually referred to by the United Nations Refugee Agency and slowly government supported. Privately sponsored refugees are identified and supported by private sponsor in Canada. Blended visa office refunded. Refugees are referred by the United Nations Refugee Agency and jointly supported by government and private sponsors. Under Resettlement Assistance Program, the Government of Canada help government assistant refugee and other eligible clients when they first arrive in Canada by providing direct and financial support and funding the provision of immediate and essential services. Second, financial includes a non-time startup allowance and monthly income support typically provided for up to 1 year or until client can support themselves, whichever comes first.
Hi, I'm Paul, and I will report the topic PTSD in Canada. Canada is committed to addressing PTSD. We passed the Federal Framework on Post-Traumatic Stress Disorder Act in June 2018. The act recognizes that all Canadians can be risked for PTSD and that a great number face higher risk because of the nature of their work. The act led the National Conference on PTSD in April 2019. Experts from across the country, including people with lived experience, shared their knowledge and views with their involvement. We have developed Canada's first federal framework on post-traumatic stress disorder. The Federal Framework on Post-Traumatic Stress Disorder Recognition, Collaboration, and Support improves tracking of PTSD and its economic social cost, promote and share guidelines and best practice for diagnosis, treatment, and management of PTSD, and create and distribute educational materials, nursing consideration, and assessment tools.
Nursing consideration, first of all, promote skin integrity. Encourage the patient to avoid scratching and apply non-perfumed moisturizer to perform daily oral care. And the next one, promote usual bowel pattern. In the nurse should monitor any abdominal pain, cramping, and frequency and consistency of the stool. Improve activity intolerance. Assist the patient in daily living activity that helps the patient to maintain balance between inactivity and rest. Maintain thought process. Friends and support network members are instructed to speak to the patient in simple, clear language and give the patient sufficient time to respond to the questions. Next, improve airway clearance, relieve pain and discomfort. Improve nutritional status.
So next one is the assessment tool. Hello everyone, my name is Simranjeet Kaur and I'm going to do the assessment tool. So at first we have to assess the nutritional status of the patient by obtaining a diet history, identifying all those factors that may affect the oral intake. After that we have to assess the skin integrity. Assess the skin and mucous membrane and daily inspect for any evidence of breakdown, ulceration or infection. Then after that we have to assess the respiratory status of the patient. Then in the respiratory status, we have to assess the by monitoring the patient for cough, any sputum production. Then after that, we have to assess the neurological status by assessing the level of consciousness, orientation to the person regarding the time and place, and about the memory lattices. So after that, fluid and electrolyte imbalance. So we have to assess the fluid and electrolyte imbalance by examining the skin and mucous membrane for turgor and any dryness. Then we have to assess the knowledge level of the patient, like about the how much information the patient have regarding the HIV, and about the treatment and about the resources.
For self-help strategies for PTSD, First, educate. Learning about anxiety and PTSD. Learning about anxiety and PTSD, no matter what type of anxiety problem you are struggling with, it is important to know the facts about anxiety. Fact 1. Anxiety is normal and adaptive system in the body that tells us when we are in danger. Fact 2. Anxiety can become a problem when our body tells us that there is danger when there is no real danger. Learning slow breathing to calm down. Building your anxiety management toolbox. Learning to calm anxiety by slowing down your breathing. Grounding is very helpful technique if you are experiencing flashbacks and you find yourself sometimes losing touch with the present moment. Having this symptom of PTSD is not only terrifying you, but it can also be scary for people around you. And grounding teaches you to stop losing touch with the present moment by concentrating and focusing on the present or by directing your attention to something else. So for tool 4, getting back into your life, sometimes adults with PTSD will stop doing the things that they used to enjoy. The best way you can help yourself is to deal with these fears is by facing them rather than avoiding them. Nursing consideration for PTSD symptoms. Cognitive therapy. A type of talk therapy, cognitive therapy helps patients to recognize and modify potentially harmful thinking patterns, such as fears that traumatic events will recur. Next is exposure therapy, used to help PTSD patients reduce flashbacks and nightmares. ET or exposure therapy lets patients safely face frightening situations and memories until they are better able to cope with them. Eye movement desensitization and reprocessing, used in conjunction with exposure therapy. EMDR therapy involves a series of guided eye movements that help patients process traumatic memories and manage their reactions. Next is psychopharmacology. PTSD symptoms can be treated with any multiple types of medication, including antidepressants and anti-anxiety drugs. Strategies for treating PTSD vary from person to person, and determining the optimal intervention strategy for a given patient requires careful assessment. Training in psychopharmacology and psychotherapies is essential, but advanced communication skills are also crucial.
So there, for the local resources, there are different kind of local health services in the Thistletown Beaumont for the HIV patient, where they can get the information regarding the HIV, and that provides support to the patient. At first, I would like to discuss with the Canadian AIDS treatment information. They can connect the people who live with HIV, and it is the best source for up-to-date information. They will help the patient to improve the quality of life and health education given by the expertise. Patient can get information here, and this will help to minimize the risk of transfer and improve the quality of life. The second one is hivnow.ca. It is the online resource that is helpful for the HIV risk assessment and information regarding insurance, and patient can get the information related to her medical insurance. The third one is the two-spirit people of the First Nation that help in providing education regarding prevention, psychological support for the two-spirit and the people who are under the risk. Then third one is the African and Caribbean Council on HIV and AIDS. So this one also provide guidance and support for the African, Caribbean, and Black communities who suffered from HIV. And next one is the AIDS and Sexual Health Info Line. So that is operated by the City of Toronto, and patient can call and get the information regarding the HIV treatment. So after that, AIDS Committee of Toronto. It works for to reduce the HIV new infection. It will help the patient to promote independence, dignity, health, and her well-being. Then after that, Women and HIV Initiative. So its main mission to reduce the transmission of HIV among women and address the HIV patients and build a safe environment that will also support the patient. Thank you.
Local resources for PTSD, symptoms of post-traumatic stress disorder during the COVID-19 pandemic. Next is Veterans Affairs, post-traumatic stress disorder and war-related stress. Next is National Defense and Canadian Armed Forces, post-traumatic stress disorder. Next is Public Safety Canada, post-traumatic stress injuries and support for public safety officers. Next one is Canadian Institutes of Health Research. And the last one is Anxiety Canada.
And for our reference, these are the reference that we've used in researching for HIV, PTSD, and for our case study. I hope you enjoy listening to our presentation. Thank you and have a nice day.